Hello everyone, this is Lisa Morkovich and I'm here today to talk about exposure therapy and why CBT is so effective with anxiety disorders. In my previous YouTube post, I touched upon what CBT is. It was a brief introduction, so please check it out if you haven't already done so. So what is exposure therapy? I guess is the first thing I should probably discuss. So exposure therapy is exactly what the name suggests. It exposes the individual to the feared objects, feared context. So for example, if the individual has anxiety attacks whenever they go into an elevator, the purpose of exposure therapy would be to either imagine yourself in an elevator, put yourself in scenarios where you're in some kind of an enclosed space or in a crowded area or anything that basically simulates an elevator, or to go into the elevator. The idea is the more that you expose yourself to what you fear, the more you become desensitized with it. Oftentimes in CBT treatment, along with like the exposure piece, the thoughts are examined. I discussed this actually in my previous YouTube post where I talked about how distorted thinking has a huge influence on how we feel and how we behave. For example, if you are terrified of going into an airplane and flying and you have panic attacks every single time you even look at airplanes because your distorted thinking, your unrealistic thought is that you will die. The second that you get into an airplane, you will suffocate, you will die, you will throw up. It's extremely dangerous. It makes sense why flight or fight is activated when you're in an airplane, because you literally think that you're going to die. So of course you're going to want to fight for your life. Of course you're going to have panic attacks. So what a CBT therapist would do would be to challenge these thoughts. And then the exposure piece would be to look at pictures of airplanes, imagine yourself in an airplane, maybe visit airports, all with the guidance of a CBT therapist. So please let me know what you think. Please let me know if you've been have done CBT treatment. If you have an anxiety disorder, please, contact me. I would love to have a dialogue with you about this, and look for future posts. Thank you. Bye.